Good evening, Los Angeles, and thank you again for joining me here at Los Angeles City Hall for the end of the week briefing on everything we've been through this past week and the incredible and heroic work that you all are doing in Los Angeles to make sure we are leading when it comes to combating COVID-19. And thank you again from the bottom of my heart for everything that you're doing in your homes, for those of you that are critical workers who are out there still on the front lines, to our first responders, and of course, our healthcare professionals that are literally saving lives every single day, to our county partners, my fellow city leaders, everybody who is taking part in what has been the most heroic coming together of Los Angeles across all the boundaries and the zip codes and the things that have divided us in the past. We are a united city, and I'm so proud to be alongside with you. You know, I was thinking about a week ago where we were, and I thought I'd just review because weeks now seem like months, and days can even stretch on like years. But a week ago, we were together celebrating the United States naval ship Mercy in a port. We were looking at the numbers, and I'll just run through. We were saying that there was 257 new cases a week ago on Friday, and 1,465 total cases, with 5 new deaths. A week ago, we were at a place where we thought that the tip of the spear was coming, and the help was starting to come as well. It's now been 15 days since we have been at stay-at-home order and 19 days since we started practicing our physical distancing. And I want to thank you because we're already seeing some hopeful signs, but also the need for us to continue to be even more disciplined with staying at home, keeping our physical distancing, isolating, quarantining, and doing everything we can to flatten the curve. Just this week alone, it was this week we closed, last weekend, of course, our trails, our beaches, our iconic places that we go. It was this week as well that we saw everything from the visitors to our construction sites and guidance for our construction workers, the suspension of farmers markets until they had plans to maintain social distancing. And thank you to all of those markets that have stepped up and have listened to what we did already. 31 of them have submitted plans, and 16 will be open this weekend with the same social distancing and physical distancing rules that we demanded. Thank you for keeping our amazing farmers markets going while making sure we're not spreading COVID-19, and everybody for abiding by them. This week we expanded protections by saying that rent would not go up in any of our rent-stabilized apartments. The City Council, together with, I took action to make sure that we could take not just 6 months, but 12 months for folks to be able to repay their rent. We saw our ambassadors program roll out, visit over 540 businesses, pay follow-up visits to about 150 of them, and 27 have now been referred, including the first 4 that now the city attorney has filed charges on. This was the week we also got the Department of Water and Power to ensure they could cut off the power of any businesses that did not abide by these, whether it was smoke shops or others that we saw that were thumbing their nose. We said, you're not only thumbing your nose at these regulations, you're endangering your and all of our lives, and so we're shutting you down. This was also a week in which we saw new beds open for our homeless Angelinos that needed a place to go. Tonight, I'm proud to announce that we have more beds that have opened up. I'll get to those details in a moment, but let's run through today's statistics. It's a lot that's happened in a single week on this day 22, as we count it, since the city has jumped into being among the very front of the line and leading in this country and in this world on our response to COVID-19. So today we got the LA County numbers that we increased by 521 cases. That takes us to 4,566. That's a 13% increase. On one hand, there's good news. This is the 3rd day in a row that we've seen low teens or mid-teen increases. To put that in perspective, that is compared to the previous week, we saw almost 27% increase on an average day in the previous week. This week, the average was about 18% increase a day. So, in other words, a week ago, the rate of increase was about 50% more than it is right now. But on the other hand, before you start to get relaxed and say we can go outside, this is a moment to continue pressing on the accelerator, because even though the rate of increase has slowed down, let me put this in perspective, we have 1,000 cases, new cases, that have been identified just in the last 48 hours. 1,000 more Angelinos who have come forward positive with COVID-19. To put that in perspective, it took us 23 days to get to the first 1,000 cases. We've done that in just the last 2. So even as we slow the rate of growth, the cases are still growing and will continue to be hundreds and hundreds, possibly in coming days, more than 1,000 a day. And of course, most tragically, we saw 11 new deaths, making the total number of deaths now recorded as the result of COVID-19 in LA County as 89, and that's a 14% increase. Our deaths and our diagnosed cases are doubling still every 4 days. So even as we do our work of pushing that curve out, it is not time to relax, because the more we can push that curve down, the more chance we have of seeing those numbers not increase by as much. That means hundreds of people who won't be diagnosed with COVID-19. That means dozens of people who will not die. So continue doing that good work as well. Let me turn to our testing as well. Last week at this time, we had conducted 5,000 tests through the city testing facilities. I said that by the end of this week, we would triple that, doubling our capacity to over 10,000 a week, making a total of 15,000 tests through our facilities. And not only we did that, we exceeded it to 16,000 tests through those sites. Remember, 2 weeks ago on Friday, we launched our first city-led site for testing next to Dodger Stadium very quietly. By the next Monday, just 3 days later, we were at 4 sites and 5 sites by week's end a week ago from today. Now we added 7 more this week, and we're up to 12 sites, the city and the county together. We now have the capacity to do 3,500 tests a day in this coming week. So we've done 16,000, combined with 25,000 tests done by providers and our public health lab in the weeks before. We've now tested 40,000 Angelinos. That's the equivalent of 1 out of every 100 residents of the city of Los Angeles. And we expect to see about 30,000 new tests total between city and county and our provider testing centers next week alone. So we will nearly double the total number of tests we've done in all the weeks up to now. Again, we do have spaces available, and we're going to open the aperture a little bit this coming week as we have more capacity, so that more people can get tested and people who might not have as extreme symptoms can get in there. But again, this is not for people with mild symptoms, but you can go to coronavirus.lacity.org. You can live anywhere in LA County and sign up to go to one of these drive-through centers and one walk-up center that we have as well in this coming week. If you don't get an appointment for the next day, and we're closed on Sundays, but Saturday and then Monday, don't worry, it'll push you to the next day to make sure you get a test as soon as possible. Next, let me update you on beds. There were 1,627 beds that are currently available. That includes 286 ICU beds, 890 ventilators, down from yesterday as we do see more people coming into our hospitals. This was a big week, obviously, on giving guidance for our face coverings. I could see it all around the city. Thank you to everybody who is out there making homemade ones, buying them, taking cloth, non-medical face coverings, and doing your part to prevent the spread from you to others. You, again, may be contagious, but not symptomatic, and this is a great way to stop those droplets from hitting other people and them getting sick. So thank you again. Don't take the N95s away from our medical professionals, but it was great to see LA lead on this. So many other cities have followed in the last 2 days, and we even heard the guidance finally today from the Centers for Disease Control recommending that people do this as well. So thank you, and again, you can go to LA Protects and use the hashtag LA Protects to find great ways that you can make them, buy them, and we are working with our local manufacturers to produce 5 million of those here locally. Some other new news, we moved forward as well on preferential parking district assistance. For any of you who live in preferential parking district neighborhoods who are waiting for those permits, and we are giving folks a 2-week print-at-home permit that we'll be emailing to you, so you can just put that in your car, not get a ticket. For those of you who have already sent away and aren't getting those in the next 2 weeks, you have a grace period with your existing one for the next 2 weeks. Again, folks can't park in those preferential parking districts without that, but if you have an old one, you're good for 2 weeks without a ticket. And for those of you who hadn't already submitted, you can now get that extension through email tonight. I spoke today also, wanted to update folks with some of our national leaders, with senators. This week, twice I spoke with Senator Kamala Harris. I spoke with Amy Klobuchar today as well, looking at what we can do to influence the next round of legislation that's coming out of Washington, D.C. And I also spoke with Treasury Secretary Mnuchin today as well. I led a letter of the 35 most populous cities in America asking for the assistance that's coming directly to cities, for any city of a population 500,000 or larger, to make sure that we can spend it on all the things that we are doing, from stepping up on testing to helping us have field medical facilities like we're building out at the convention center, and so much more. It was a very good conversation. I appreciate Secretary Mnuchin's help, and also that today, his very ambitious schedule of getting assistance out today, just 2 weeks after legislation passed, $1.5 billion started to flow through the SBA assistance to small businesses. I told him that cities were ready, willing, and able to help our businesses step up. Already around the country, I conducted a conference call with a number of different mayors. We estimate about $500 million in local dollars in micro grants like the ones we did with our $11 million program went out immediately to try to bridge this time between now and when the SBA loans will flow. That said, we know that the big muscle that's coming in is from the CARES Act, and we need to get that money into the hands of businesses now. I also told him that we need to take care of those small businesses that won't be covered by the big banks. And that's something that I hope in the next round of legislation, working with people like Speaker Pelosi, working with the White House and others, we can get that into the next round of legislation. We also have other money coming this week. $50 million from our Housing and Urban Development Department. That includes $31 million in what we call Community Development Block Grant money. This is money that we spend to help the poorest among us. And we can use this and will use this on things like eviction defense. I know many people are concerned the day after we see this emergency end that folks may find eviction notices, and we want to make sure that people have proper legal representation. We're expanding our domestic violence shelters, services, and assistance so that nobody has to stay at home in an abusive setting and environment, but they can stay in shelters that we are expanding the capacity of. It'll go towards training and business assistance for workers that have lost their jobs and small businesses that are hanging on. And it also includes $16 million for our emergency solutions grants. These are homeless dollars that we'll put into services, into shelter, into transitional housing, and also to help people who have recently become housed, stay housed during this crisis as well. And also almost $3 million for housing opportunities for people with AIDS, or HOPWA. These are for some of the folks who are the most immunocompromised. We want to make sure that they are safe, that they are housed, that they have the assistance they need so that they do not become COVID-19 positive as well and become among the most vulnerable to losing their lives as well. As many of you know, before this crisis, we've been building many bridge home shelters, transitional shelters for unhoused Angelinos. And I'm very proud to say our 13th bridge home shelter will open in the midst of this crisis at the VA, which will help give us even more beds for our homeless brothers and sisters that are out there on the streets. Today, 140 new beds will be available tonight in 3 new recreation centers in congregate shelter settings. That takes the total to nearly 700 beds across the city, and if these 3 are like the rest of them, they will be at 95 to 100% filled right away. And I want to thank the nurses and the Rec and Parks facilities, the mental health professionals, and LAPD, everybody that is making those successful and making them work so that we can bring more people into safe locations. And I'm proud to announce as well that today the Board of Public Works approved a historic partnership with the YMCA, where 9 facilities will be available for folks who need to take showers, folks who need to use a bathroom, folks who are living on our streets but need to have the same sanitation requirements that those of us that are housed doing. And I want to thank the YMCA. It'll also help produce jobs for folks who have been either laid off or have lost their hours to be able to staff those, and making sure that we have even more sanitation on the street. And we put dozens of new porta potties out on Skid Row and other places around the city in the last couple days as well. Also, in terms of our homeless response, today there are 11 leases and 780 rooms. These are hotel and motel rooms available for unhoused Angelinos. And these are folks who need to be isolated, but they are not yet positive. That means that these are the most vulnerable or the most senior homeless Angelinos that we have that we can get safely in. And I'm hoping that we can fill those 780 rooms as quickly as possible with the county and with our Homeless Services Authority. On top of the other 700 beds, that's nearly 1,500 solutions for Angelinos who are homeless just days ago. Let me also speak to ways that everybody can help. And thank you all who have called and said, what can I do to help? How can I donate? What can I do to offer some assistance? And so now we've made it easier for you by putting a new nonprofit directory that will match nonprofits. These are food banks or people who are assisting homeless Angelinos, people who are providing comfort and care to our seniors who are isolated, to match volunteers with organizations. And it's called Inspiring Service. And if you want to volunteer, or if you're an organization that needs volunteers, from a neighborhood council to a local food pantry, you can use this and we will match you with folks who are ready to help. You go to volunteer.lamayor.org and then click on the nonprofit directory button to see more about Inspiring Service. And thank you in advance to all the Angelinos who have signed up to help and who are going to help us get through this. I also want to thank on the volunteer front a couple other folks who have donated this week to the Angelino Fund and the Mayor's Fund for Los Angeles. We all know and love Connie and Steve Ballmer, who own the Clippers, who have helped us renovate every single gymnasium and outdoor basketball court in Los Angeles before this crisis started, who have just been incredibly generous folks helping us expand community policing in a partnership that intervenes and prevents crimes and helps lift up young people by keeping our parks open late in the summer. Well, I'm proud to announce that tonight they have donated $2 million to our ongoing efforts to make sure there's child care for our healthcare workers, to get direct assistance into the hands of our neediest families, and also to make sure that our seniors have meals. And a second thank you goes out to Evan Spiegel and Miranda Kerr. Through their generosity and through SNAP and through the SNAP Foundation, they've already donated $10 million in assistance to community groups around, including a multi-million-dollar gift directly into the Angelino Fund and the Mayor's Fund for Los Angeles. And one final thank you to two people who are absolute pillars of our city, Eli and Edie Broad. I want to thank you for your $500,000 donation as well to help us continue getting money in there. The Angelino campaign this week will start spending that money. In fact, there's 2,000 Angelinos who have already are already receiving $500,000 in assistance, and the $1.2 million in grocery gift cards will be out the door this week. That's money in people's hands to get the food that they need to keep their families nourished, and $1,500 cash grants to Angelino families on no-fee debit cards, thanks to MasterCard's City Possible network and Accelerator for America, will help us make sure that some people who have been overlooked by the federal cash grants will get that assistance as well. And we're going to keep raising that money. So anybody who wants to donate, please go to mayorsfundla.org. Every dollar that goes in goes straight out to a needy family, to a family of a healthcare provider, or to our seniors to make sure that they are fed. In a city where we have 20% of people living in poverty before this, and so many people who have lost so much, this has become a national model, and we want to get as many resources in there as possible. I also want to thank some great companies that have helped out. Triller, which is a digital media streaming company in Hollywood, donated 150,000 N95 masks to make sure that our first responders, health care workers can be protected. Thank you for that so much. And all of us have seen just incredible acts of heroism, of generosity, and of kindness. So it's a lot, I know. For 1 week, I wanted to make sure everybody had that update directly. But let me just end with this. This week, I haven't taken a break in 22 days, but I just want to indulge you and say thank you. Thank you to my family, to my daughter Maya and my wife Amy Elaine, and thank you to my staff here who has worked around the clock as well, maybe even less sleep than I've had. They're here in a bunker in City Hall. To those city workers that are out there, whether you're in a shelter taking a night shift, whether you're an LAPD officer doing something you haven't done before, a firefighter who's at one of our testing facilities, helping folks be able to swab their cheeks and get answers to whether they have COVID-19, you all have been true angels in this city of angels. To the rest of the city, I'll say it again, this is a critical week. Each one of these weeks is, but we've seen good progress. We've seen people staying home, but don't let up. This will be the week where we'll continue to see hundreds of people each day become positive, that we will see, unfortunately, too many souls lost each day. And when we hear those numbers, and our heart goes out to every family tonight mourning somebody that they've lost and that they couldn't hug one last time, we know that we are doing this for you because we believe in human life, we believe in our city, we believe in our strength, and we believe in a future that we will march towards together. Los Angeles, we will get through this, but we will only get through this if you stay healthy, if you stay strong, and if you stay home. So I'm wishing you this weekend all strength and all love. Thank you for who you are and what you are doing. In the days ahead, we will define what Los Angeles will look like when we come out of this. But right now, we are in the midst of war to fight and to protect lives. And I thank you for that. May God bless you. God bless your family. Have a good weekend. And with that, I'm happy to answer questions. Thank you.
Thank you. And our first question comes from Steve Gregory from KFI News. Please go ahead.
Hi,
sir.
Steve.
Mr. Mayor, good afternoon. A couple quick questions. The USNS Mercy, we find out, has only got 17 patients on board, and we understand that there have been conversations behind the scenes to possibly accept COVID patients on that ship. That first question is, have you heard anything of the same? And does that change sort of the dynamic or landscape of what that ship's capability is? Secondly, taking a drive around town today, I saw a lot of businesses open mobile dog grooming, mobile car washing, landscaping, tree cutting. Are these all essential services? And finally, in lieu of what's been revealed on the county level about them hiring a PR firm to help them get messaging out, has the city done anything similar? Have you had to hire outside agencies for any help putting your messaging or anything else out regarding the virus? Thank you.
Thank you. The last question, no, we've been doing it all in-house and with existing resources, and thank you to you and everybody else in the press, as well as people who are just using social media and getting out things like LA Protects, the facial coverings that they're using, all the good guidance, the videos, the songs, the music. It's been really amazing. So no, we have not had to use anybody else. In terms of which businesses are supposed to be open and which are not, it's very clear in our orders. I didn't hear the entire list. Mobile dog grooming is not one of those. People who have landscaping, yes, those things are continuing as long as they are staying distanced. So it's very clear online. We've had, as I mentioned, over 500 plus, and that's a couple days old. I'll try to get updated numbers, inquiries, and where we've reached out to companies and made sure that they are shut down. We've visited over 100 of them, and now 27 we have proceedings against, including the first 4 criminal prosecutions that we launched here today. So, and then the first question on Mercy, I have not heard that they're going to be accepting any COVID-19 patients. There's 9 patients on board, which speaks to the capacity that we still have today in the Southland. This is kind of, again, our backstop when things get really bad. So I wouldn't worry that there aren't hundreds of people on that ship. They are prepared to accept. But they also have said we're going to be fluid. So right now, that is imagined still as a COVID-19 bubble, a place that can be free from COVID-19. But if things get bad, I think there's some flexibility, they said from the beginning, but we'll have to monitor that day by day with the hospitals, with the bed count, with the ventilators, and we'll take it from there. Thanks. Next question.
Thank you. And the next question comes from Alex Michelson from Fox 11 News.
Hey, Alex.
Go ahead.
Hi, Mayor. You talked about the fact that you've been working for 22 straight days. I know you've been working in government for a very long time. And I'm just wondering, sort of on a personal level, how do you compare this experience to anything else that you've done? How are you holding up? How are you keeping your mental health strong? And what's your advice to all the Angelinos out there that are feeling desperate and anxious and having mental health challenges right now?
Well, first of all, to folks who are struggling with mental health challenges, there is help out there. Whether it's the crisis text line, whether it's LA County's mental health line, or as I talked about yesterday for students, LAUSD has counselors available from I think 6 a.m. to 6 p.m. for families and students to speak to as well, because this is tough. And I wouldn't underplay that. I know each night maybe we feel a little bit less and less. Each one of these briefings sounds like it's the same numbers. The numbers just keep going up, and we wonder when this is going to be over. We're all carrying a lot of pain right now, and I think we're carrying a lot of mourning for those that have died, and for some of us in a very direct way, for all of us just knowing people are dying, and those of us preparing for the people that will die who we don't know yet, and we wonder, is it somebody whom we love? Is it somebody that we know who's fighting another disease? Is it our parents or grandparents because they're older and they are more susceptible? So please, to everybody, continue talking to people, reach out. If you have really tough thoughts, reach out to a professional as well, and you can get those referrals that are on coronavirus.lacity.org, or just go to the county Department of Mental Health for those referrals. For me, and thank you for asking, Alex, I'm strong, I'm steeled, and I'm scared. When people ask me how I'm feeling, it's all three. I'm scared for all of us, for what's ahead, but I feel very strong, and I'm making sure that I get at least the minimum amount of sleep. My mental health is improved by my family and spending a little bit of time with my daughter at the beginning and end of the day, reading a book to her. I haven't watched any shows, I haven't read a book, I haven't done any of those things, but in my experience in government, this is by far the most intense thing that I've ever gone through, and I hope that we will ever go through. Experiences with fires or with earthquakes or mudslides, tragic shootings. I've been there many years, holding families after a loved one has been killed, talking to people after their home has been destroyed. But I think there's one thing that comes back that trained me for this moment. Each one of those tragedies taught me we can replace anything but a life. So remember that. That's what's precious. And if you're waking up and you're alive, even with the challenges that we each have, that's a good day. And let's just put one foot in front of the other, or if you're home, cross your legs on the couch and get to the next thing in your Netflix queue, or call somebody, and let's just get on one day at a time. I would never have imagined that 22 days would go by this quickly. I know we have at least that ahead, but if we get to the midpoint soon, 1 month into this, we can do that for another month, and then we'll come out of this, and we will deal with what lies ahead. We'll deal with the economic challenges, we'll deal with the city challenges, and I know that we can meet those together if we can get through this. So thanks for asking, Alex. I hope you're looking after yourself, too. Next question.
Thank you. And that comes from the line of Christine Devine from Fox 11.
Hey,
Go
Christine.
ahead.
How are you? You there, Christine?
Is your phone on mute?
I want to hear from Christine, so.
Miss Devine, your line is open.
I don't know if we lost Christine. But hey, Christine, sending you much love.
Well, we'll just move along. She can
Okay.
queue up again if she gets her phone working correctly.
We'll get you, Christine.
And
don't worry.
We'll move along to the line of Robert Kovacic from NBC. Please
hey, Robert.
Go ahead.
We're getting closer. How are you, Mayor Garcetti?
Good. I'm hanging in there.
Two questions for you, sir. First of all, you mentioned the crisis text line. I spoke with the founder yesterday, and she is very complimentary about these daily briefings that you are giving, saying that information helps to quell the anxiety so many people are feeling right now. Their text line is up almost 50% since this began. They are now seeing a second wave after the initial anxiety of those callers that are fearing domestic violence and child abuse.
Yes.
Are we concerned, and are we seeing an uptick in this in the city of Los Angeles? And secondly, you mentioned about the businesses right now that are going to be under prosecution by Mike Furer's office. Is there a way right now for people to directly contact the LAPD if they spot something within those businesses or businesses that are staying open that they think should not?
Absolutely. Call 311, not 911, but call 311, and we're rolling people out pretty quickly. So you can call 311 or the mayor's helpline. Either one we will refer to LAPD, or the general LAPD number, which is not a 911, but you can Google that easily, and they have a non-emergency direct line to LAPD. Please let us know that. I met today with the police chief. He's ready to kind of ramp up this to get even more serious. I think we've had a good week and a strong week. We sent that message. And I always remind people, we can find folks who are not abiding by this, but thank you to the 99.9% of people that are. The data shows that. We know that. For the folks that are still out there that are flaunting the law, we will find you. We will come after you, and we appreciate you passing that on to us. In terms of the mental health piece too, thanks for pointing that out with Nancy Lublin. She's great, and their whole team has been doing an amazing job. But in terms of domestic violence and child abuse, we are not hearing that yet, but many more people are at home. And if they're in vulnerable settings at home, even with a stay-at-home order, you should call 911. You can text 911 if you're scared about getting onto the phone. And as I mentioned, we are going to be expanding our domestic violence beds and services to accommodate folks who need to get out of a difficult setting. Do not think that stay at home means you have to stay at home in a dangerous situation. We will and we can help you, but please use 911. If you don't feel safe enough to do that on 911 through a call, you can also text 911. We are one of the first cities to be able to do that, and we will send help. Thank you. Next question. Oh, and the number, sorry, 1-877 Ask LAPD.
Jory Rand of ABC7. Please go ahead.
Hey, how you doing?
Mr. Mayor, thank you once again for taking our questions. I'd like to echo your sentiment to those who are working around the clock and not getting much sleep. ABC7 certainly sends our appreciation to them as well.
Yes.
I know in the past you've been hesitant to compare Los Angeles to New York and the numbers there, but with our rate of growth appearing to, at least the rate of growth flattening over the last few days, do you still see us on track to be about 14 days behind New York, or have our paths diverged now? And also, having spoken to people on the federal level today, and that sounded more like financial assistance, how about equipment? On the federal level, Jared Kushner said yesterday the national stockpile isn't there for states, it's there for the federal government. And overnight, the wording was changed to match that on the federal website. So maybe this is a question better suited for the state, but have you had any interactions requesting equipment from the federal government? And if so, how has that gone? Do we have any shortages of things like ventilators or PPE? Thank you.
Thank you. So let me start with that, because I had a briefing today with Gene Soroka, who I mentioned is the Chief Logistics Officer now for the city. His usual day job is running just the busiest container port in all of the Americas at the Port of LA, but he has an extraordinary background in knowing how to procure, meaning buy things, the supply lines, seeing what's on ships before they get here, talking to folks who manufacture in Asia and other places. So he gave me a good update. And we're working very closely with all the hospitals, the Hospital Association, and trying to put together a historic kind of buying collaborative where the city of Los Angeles can bring together the needs of all of our hospitals, not just in LA City, but LA County and potentially the region, maybe even build with other cities. But because Gene and because of the staff that we have here so talented, we're able to kind of pull that together. The city would front that cash, and then hospitals could get what they need as well. I think hospitals right now are looking, they basically have around, depending on what the equipment is, PPE stuff, about a 2-week supply. So we're okay today, but we need to make sure that we get deliveries in the next couple of weeks coming in steadily. And as our volume ramps up, those supplies could go away very quickly. As I mentioned, our ventilators are down by about 100 today since yesterday, still about 900 or so, but we need more, and we're looking at being able to purchase those through the city's kind of collaborative and our Emergency Operations Center and Gene's work as well. So that is all very important. In terms of being behind New York, we still are. New York also has similarly reduced the rate of increase. So it makes me think, we started a few days before them, but that the physical distancing measures are having a similar effect now that we're into about 2 weeks into those. Both in New York, they're a little under 2 weeks. We're a little bit over 2 weeks because we were earlier. So no, I think we're still tracking pretty parallel with them. I didn't do the calculations today, but yesterday we were 11 days behind them in terms of our per capita deaths in LA County, 14 days in terms of our per capita cases. And remember, they have many, many more tests, although we're ramping up and catching up with them on terms of testing. So their numbers were probably larger from that. In terms of official numbers, we probably have more that are unofficial because we simply haven't gotten those tests back or haven't conducted them with as many people. So I still think that people should not let up. As I said, in the last 2 days, we had as many cases as it took us the previous 23 to have. If that doesn't sober you, if that doesn't steel you for this weekend and the week to come, nothing will. Thanks for the questions. Next question.
Thank you. And that comes from the line of Claudia Pisciuta from KNX Radio.
Hey, Claudia.
Go ahead.
Hi, Eric. I know you were asked about making face masks a requirement for all people, but I'm wondering if maybe you've given any thought to requiring them for essential workers at this point. And then also, if you could just run down the rec center / temporary shelter situation. So initially it was supposed to be 6,000 beds at 42 rec centers, but social distancing has obviously cut that down. So now what is the total plan? How many rec centers, how many beds, and by when?
So
Thank you.
Thank you, Claudia. So the beds is going to be fluid. Right now, the numbers that I was announcing, I think now we're opening 3 more tonight. Let me make sure I get that. 3 new rec centers, adding 140 beds. That is going to take us to 695 beds right now. We're looking at another 13 coming in the coming week as well, so maybe a doubling of that to about 15 or 1,600. Once we did the calculation, the 6,000 was reduced by 2/3 to about 2,000. So we'll be most of the way to those 2,000. Now, we'll make decisions next week, depending on how many hotel and motel beds come online, and the staffing of those. Just because we get a motel, we need to similarly have staffing just as we would in a rec center that the county and LAHSA are leading. That's security, that's health care workers, that's all the things that we have in terms of food, and of course allowing people to have showers and stuff, which gets a little easier in a hotel or motel room. So we don't anymore have a fixed number, but there with the hotel and motel rooms is really where the ramping up will be. Thousands of them. I think the county was talking about going as high as 15,000, but these are stretch goals. Right now, I hope that we can get into the thousands of people in those hotel and motel rooms in the next 2 to 3 weeks. If we do that, then I think the sky's the limit. Thankfully, this week, good news, FEMA said that they would reimburse us for hotel and motel rooms for folks before they're sick who are homeless. That's never been done before in an emergency. So thank you to FEMA, who in the previous question asked whether we've done a lot of work procuring things with the feds. Not so much on the procurement, but FEMA has really been a wonderful partner in helping us work through the reimbursement so that we can just buy these things, secure these rooms, et cetera, ourselves. In terms of masks for essential workers, we are working on an order probably in the coming week. We want to make sure that there's supply. We could say for everybody, you have to have them, and it was yesterday, it is now our official recommendation that people have that. In terms of mandating that for everybody in, for instance, grocery or pharmacy or retail environments, we want to make sure that the capacity is there. So we're working with all the folks that are manufacturing those. We're trying to buy those as well, but you can rest assured, know that in the coming week we will have that in more official order. I've talked also with the county, the city of Long Beach, and they're going to be moving together with us on that. Thanks, Claudia. Next question.
Thank you, and that comes from Haley Winslow from Fox 11. Please go ahead.
Hey there.
Hey, Mayor. Thank you very much for everything you're doing. Just out of curiosity, I FaceTimed a woman today at one of the new testing sites, and she pulled up, and her name and confirmation number had already been used. Obviously, I'm sure it's an anomaly. It's not something that you're seeing often, but what is being done to make sure that doesn't happen in the future, and how does something like that happen?
Sorry, so just to clarify, her name had been viewed by whom?
She pulled up to the testing site, and her name and her confirmation number for her appointment had already been used earlier.
Oh, had already
today
been used. Sorry, I thought you said
by somebody
viewed.
else.
That's the first case I've heard of that. I'd be hard-pressed for people to know the name, and they also have to show something from a printout. So I think that must have been an anomaly. We'll make sure to take care of her. I think on site probably, since we had the capacity, hopefully she was able to do it. Some people have also driven up who have not gotten an official ability to have one, and we've had to turn them away because that is for only certain people, and they say, oh no, I went through it, I had something, but you have to have that confirmation. But in this case, that's the first I've heard of that, but we'll take care of her if she had one. If somebody took it, I'm surprised they'd know her name or number, but we will make sure she's taken care of. Thanks so much.
And she obviously wants to make sure her results are hers.
Yeah, of course. We'll make sure. Those are two separate bar codes, so she will have the integrity of her test. Nobody else will get that, especially if she's stepped up there. But if you haven't passed that on, if somebody didn't talk to her there, will you please let us know? You can even just send that to mayor.garcetti@lacity.org. Thank you. Next question, please.
Thank you, and that comes from the line of Jintak Khan from the UCLA Daily Bruin. Please go ahead.
Hi there.
Hi, Mayor. Thanks for taking my question.
Of course.
Governor Newsom mentioned towards the end of his press conference today that the state is considering serological antibody testing for COVID. And has the city considered such like antibody testing or antibody treatment of any sort?
Absolutely. We've been following this closely. Again, the city isn't really in the medical business, but we've stepped into that lane to help out because everybody's stretched thin. And we've had great partners with the county who have led the public health side marvelously, and of course their official hospitals and the planning really beautifully too. In terms of stepping into that place, which would give us, again, these tests will show people if they've had it, not necessarily that they're contagious, and folks that are contagious, as Dr. Ferrer said yesterday, it's a different sort of test. But being able to see the incidents out there, I think, is very important. And these tests will be critical moving forward as we begin to reopen up the economy in future weeks and letting us know who has carried this and who now presumably is immune, although the research is ongoing, whether people could get it a second time or not. So I've spoken with mayors up and down California and Santa Ana. They're trying to do that. These tests are still forthcoming. So a lot of the technology of them, they're folks that are assessing false positives and false negatives that might come from them. But absolutely, we want to have that information. And as I said last night, we're working together with the county and also with USC, Stanford, some other institutions, UCLA, also on prevalence studies. In other words, how many people out there are walking around with COVID-19 and we don't know. One study showed up north that it could be as many as 8% in Santa Clara County. That's a staggering number compared to the actual numbers we're seeing coming through with tests. Second point is, too, it would be very helpful because people who do feel that they've been sick, we can confirm whether they've had COVID-19 or not. People who do get through the rigorous kind of screens to get a test in one of our centers right now, as Dr. Ferrer said, and they have an even more rigorous one for the county public health lab, it's coming back only about 12 or 13% of those people who are highly suspected of having COVID-19 as actually having it, meaning close to 90% of people have something else with the sort of symptoms that are similar to COVID-19. So having those blood tests will help us get much better numbers. We're absolutely looking at those. As long as we can get reimbursed, we're happy to help do that and to step into that lane. But I know the county is looking at that in a number of different ways, and we'll take the lead. Thank you. Next question.
Thank you.
Thank you. And our last question for this evening comes from Abel Alamillo from Telemundo. Please go ahead.
Abel, hola. Are you there?
Oh, okay.
Telemundo?
Day to brace for a big increase of COVID-19 cases starting next week, possibly up to 1,000 cases daily. How concerning is this? And here we are in the heels of another weekend. What's your message to Angelinos regarding social distancing and stay at home? En español, la doctora Ferrer advirtió hoy de un posible incremento bastante alto en los casos de coronavirus, comenzando la próxima semana, posiblemente 1,000 casos al día. ¿Cuál es su reacción? Y estamos a punto de iniciar el fin de semana. ¿Qué consejos le daría a la población con respecto al distanciamiento social y de quedarse en casa?
So I'll answer in English, and then I'll answer in Spanish and go straight into my Spanish remarks. And thank you to everybody. Sorry, Christine Devine. Hopefully we'll get you back for your question on Monday. First of all, it is absolutely concerning to me. I wanted to share good news because I think people deserve the reward of knowing that your actions are working, that we're seeing less high rates of increase than we saw a week before. That said, numbers are still increasing. They're still increasing. So we're at 500, we're going to have some days where we get to 700, 800, 900, and probably as many as 1,000 cases and beyond. Whether it continues to go up will depend on us. So my message is to stay at home, to stay healthy, to make sure that you continue to do all the things that we've recommended. I certainly don't enjoy doing any of this. While I've said at the very first day that I've made all these decisions with a heavy heart, I've made them with a very clear mind that this is the way we will save lives. And so don't let things slip. Don't start to say, oh, I can go out for a drive, or the whole family can go to the supermarket, or maybe I can, play a game of something in the park. We are looking for folks. We have many city employees that are putting their own lives on the line to enforce this measure, but you can help them stay safe. You can help them protect you, and you can protect yourself by staying at home. So we will see those numbers continue to grow, even as we hope the rate decreases, giving us at least a little light at the end of the tunnel, that we know that there will be an end in sight. But the peak of this is still weeks off in absolute numbers. That was something I tried to talk about earlier this week, that there's the rate of increase, and flattening the curve is about slowing the rate of increase. But the absolute number will continue to go up for some time until we hit that peak weeks or even more than a month from now. So we need to keep with this. We need to save lives. We need to make sure that we stay at home. Thank you for everybody in English. I'll switch to Spanish for that as well, and then I'll say a couple words. Mi mensaje es la misma. Es importante que todos nosotros toman estas órdenes a nuestros corazones. Nuestras acciones pueden salvar las vidas de nuestras familias, de nuestros vecinos, de nuestros padres y madres, nuestros hijos y hijas, y necesitamos continuar con estas acciones. Quédense en buena salud, pero quédense en casa. Cuando nosotros pueden quedarse en casa, nosotros podemos dar la esperanza a nuestras personas de tercera edad, a nuestras personas que tener aflicciones médicos. Tenemos la oportunidad con estas acciones, con estas órdenes también, finalmente no solamente a salvar las vidas de angelinos, pero a tener un futuro aquí en Los Ángeles, con una nueva economía, con trabajos, con prosperidad, pero nuestras acciones ahora pueden prevenir la continuación de la contaminación. Mi mensaje es la misma: quédense en casa. With that, let me say a few other words in Spanish as well to share information. Gracias a todos y muy buenas tardes. Antes del fin de semana, les recuerdo, lo más seguro es quedarse en casa. Y si tienen que ir al mercado o a la farmacia, por favor, lleva una cobertura facial. Como lo habíamos recomendado el miércoles, hoy los Centros para el Control y la Prevención de Enfermedades están recomendando también el uso de coberturas facial en lugares públicos para evitar la propagación del COVID-19. Hoy en el condado de Los Ángeles hubieron 521 casos nuevos. En total tenemos 4,566 casos. En la ciudad hubieron 260 casos nuevos y en total 2,047. Y hoy tuvimos 11 muertes en el condado y ya son un total de 89 fallecidos. Y lo siento mucho a las familias que están llorando esta noche porque un miembro de su familia es uno de los fallecidos. Sin embargo, con la colaboración de todos, seguimos haciendo todo lo posible para aplanar la curva, incluyendo ampliando acceso a las pruebas de detección. Abrimos 3 nuevos sitios de pruebas de detección hoy. En total tenemos 12 sitios de pruebas en el condado, con 7 en la ciudad. Y no importa dónde tú vives en el condado de Los Ángeles, tú eres elegible para estas pruebas. Tenemos capacidad para hacer 3,500 pruebas por día. Y en el total hemos hecho 16,000 pruebas en la ciudad y el condado. Esto combinado con otros sitios de pruebas quiere decir que se habrán hecho aproximadamente 52,000 pruebas en el condado al final de la próxima semana. Esto es increíble y gracias a los bomberos, los voluntarios en estos sitios por su trabajo. Para determinar si eres elegible, vaya a la página coronavirus.lacity.org. Esta noche también quiero anunciar que la ciudad está apoyando a los residentes que viven en vecindarios que requieren permisos para estacionarse. Si ya renovó su permiso, pero el permiso nuevo no llegará antes de que su permiso se vence, la ciudad la mandará un correo electrónico con su permiso nuevo. Este permiso durará 2 semanas y lo puede imprimir en casa. Tendrás 2 semanas sin recibir una infracción por tener un permiso vencido. Sin embargo, debes de renovar tu permiso de estacionamiento y cumplir con los límites de tiempo. Además de nuestros esfuerzos locales, empezamos a ver llegar el apoyo federal. Y gracias a nuestros líderes federales. La semana que viene, nuestra ciudad recibirá $50 millones del Departamento de Vivienda y Desarrollo Urbano para fortalecer programas para empresarios de pequeñas empresas, familias de bajos recursos y algunos de nuestros residentes más vulnerables. Además, recibiremos $31 millones en subsidios para desarrollo de comunidades para ampliar nuestro programa para prevenir desalojos y ofrecer a angelinos servicios sociales y apoyo económico. Y eso incluye $16 millones en subsidios de emergencia para apoyar a nuestros vecinos sin hogar o a familias al borde de la indigencia. Y también $2.8 millones para vivienda asequible para personas con VIH. También esperamos que llegue el dinero para familias trabajadoras y el programa federal de préstamos para pequeñas empresas. Y el Congreso empezará a tomar acción en desarrollar su nuevo paquete para recuperación económica. Estos fondos federales servirán para salvar vidas, así como nuestro trabajo para proteger a nuestros residentes sin hogar durante esta crisis. En los últimos 2 años, el programa Bridge Home abrió 12 refugios nuevos y 813 camas temporales para alojar a las personas sin vivienda. Para aumentar nuestra capacidad, el refugio YWCA de Hollywood agregó 60 camas en el mes pasado. Mañana abriremos nuestro refugio número 13 en el VA, en la Administración de Veteranos, en el oeste de Los Ángeles, un mes temprano. Para asegurar la sana distancia, empezaremos con solo 50 personas, todos veteranos sin hogar y sin síntomas de COVID-19, pero que tienen más alto riesgo en enfermarse en las calles. Hoy empezamos a alojar a personas sin hogar a hoteles y moteles. Y también agregamos refugios de emergencia en centros de recreación por toda la ciudad. En total tenemos 695 camas en la ciudad. Finalmente, quisiera anunciar nuestra colaboración con la plataforma Inspiring Service, Inspiración de Servicio, para conectar a organizaciones que necesitan ayuda con personas que quieren trabajar como voluntarios. Para participar, visita volunteer.lamayor.org y haga clic en Non-Profit Directory. Tenemos tantas donaciones generosas. Nunca he estado tan orgulloso de Los Ángeles como ahora. Seguimos adelante juntos. Amigos, hermanas y hermanos, quédense protegidos, quédense en buena salud, quédense en casa. Mucha fuerza y mucho amor. Gracias.